Welcome to the Naked Podcaster. Get ready to hear stories of someone brave enough to bear it all. Let's get naked. Welcome to the Naked Podcaster. Today we have Dr. Foojan Zain again, second coaching therapy session. And the last one, everything will be linked, but the last one I got more emotional than I can remember being in years. But what I loved about it is that you go in very, very, very deep and pulled me right back out, which is a huge part of your process. And that made it totally safe and comfortable. And I didn't have residual, I wasn't emotional residually. I was very introspective. It was really enlightening.
Wonderful. I'm so glad to hear this. And you allowed me to be with you, and you gave me kind of like the privilege of walking with you, and you becoming vulnerable and allowing yourself to go wherever your body was going to tell you to go. And that's very courageous. Sometimes we have no idea what we hit, what comes up for us. And so definitely you allowed that without holding yourself back. So this way of you being courageous and allowing whatever is to show up, I think is the key for you to get reintegrated very, very quickly. And I feel privileged that we're doing this again. We're
oh my gosh.
In another area.
It's an honor. I mean, I had read all the paperwork and filled things out, and I was overwhelmed at wow, it's a lot of, I had to do a lot of pre-work, which was great. So I had a great appreciation for your process, but it was nothing like actually going through it. So I'm so honored that I had the experience, but also people can see it, because when you read about it or you hear about it, the connection's not quite the same as hands-on. So I also love that no matter how much information, we could send information back and forth, it's going to be completely unexpected. It was ridiculously unexpected the last time. And so I love the process that you just don't know.
Right. And I think that's one of the key points of, I think I also shared with you and guided you in our work, that when I ask, let's go find the first time, that you don't go with your head and memory and what you already know, that you really allow your body and the feeling and the emotion in your body, cellular memory, muscular memory, to take you where it really relates to whatever is happening to you at that moment, because that's the key place where we have made some decisions. But our, the thought memory that we keep going back to, they are hand-selected ones that we have chosen and put it up on the shelf. And every time, like pictures, like how you put pictures up on shelves, we do that with our memories. Like there are certain ones that are always up on the shelf. Yeah. And there's so many other ones that are out there that are real that we never bring up. And that's why I ask, if you're seeing that you're going to search for the memory with your thought process, that's not going to give us. It's almost like you're just going to go through your picture album and see which one it is. But if you allow your body to tell you, then that is really going to guide us to the actual one that you made up this scenario for yourself. Mm-hmm. And that's the one we need, because that's the key to kind of like dismantling that belief about yourself.
I love how you just said the memories are like pictures on a shelf. That's so true. It is so true, because I can give you the highlighted ones, or the ones that have the most impact or reaction when you talk about them. You know what? It's our highlight reel. But it was so unexpected. So I know today is going to be equally unexpected. And I think that that's part of the beauty of this journey, because then you can be like, oh my gosh, I did not see that coming. Yeah, let's jump in. Okay.
So tell me the area of life that you would like to work on today.
We're going to talk about sex, which is one of my favorite topics.
Mine too.
I'm so happy. And there aren't very many people. I mean, it's an easy, fun topic for me, but to really dive in, it's also a pretty scary topic too. Can be. So
let's look at this area with sexuality. it might have different realms. So in our conversation, we might check out different realm about the sexuality. So when you think about the topic of sexuality, the area, the genre of sexuality, what are your thoughts about sex and sexuality?
I think it's a lot about connection. I think it's empowering. I think it's a release. Like it's physical. For me, it's a physical and emotional release. It's like a reset button. Sexuality is a reset button. It's also really powerful, especially as a woman. And I don't like to use the word control because I don't mean it in a derogatory way. But as women, you know, not in my relationship now, but there's a lot of control and power in sexuality. So I think you can use that same, I think it comes across as confidence in a relationship. So there's a lot of confidence around sexuality.
Any negative thought process that shows up with it? Any negative belief system that you know of yourself having about sexuality?
Rejection. And I know you're going to correct me if I go off of thought. I'm usually good at thought, but yes, rejection or inadequacy or failure. Yes, definitely. There are negative, and there's all the word, I mean, as much as connection is part of it, disconnect is part of it for me as well. Dissociation.
And when you feel, when you think about the genre of sexuality, what kind of emotions come up for you, positive and negative?
Oh, it's just positive feelings. It again, I think connection can be thought and feeling, can it? Just the way the skin feels and the smells, it's very tactile. I mean, I feel part of something bigger. And it's not just the person that you're entwined with. It's sexuality can be almost, you know, universal or spiritual, or it's big. It can be overwhelming. Negatively, it can feel scary. I can feel robbed, like something's taken from me. It can feel intimidating. Yeah, I think another good one is raw, but that could be a negative one also. It can be in a positive or a negative way.
So the raw on a positive level would be that it's just you're vulnerable.
Yes, open.
And you're open. Okay.
Yeah.
Open. And then the negative one,
it's the same way. It's being open, but not in a way that's positive. In a way, if somebody's taking it from you, or you can't control what they're doing.
Mm-hmm.
So
you can be a part of you could be abused if you're that open.
Yes. Yeah, you could be.
Like open, like powerless, if you look at it from that place, right?
Yep. Absolutely.
When thinking about the area of sexuality, how do you behave in the realm of sexuality? What are your actions in that realm? Positive or negative?
I chase it. Mm-hmm. And I mean, that is positive. That's a really positive thing because it's in my relationship. I want it. I put myself forward. I ask for it. I thoroughly enjoy it. So I definitely, and in a negative way, I chased it. I got it. You know, I mean, it's so interesting. This one for me, the same actions can really be positive or negative. It depends on where I'm coming from in the situation. So
how is it negative? What type of a behavior is negative when you chase, which is there's a distinction between your negativity and positivity about the same. And you said it's about how it might come from. So what intentionality when you're going forward with chasing would be bad, negative or positive?
Doing it in a way that's dysfunctional, where I'm trying to gain control and prove that that's all a man wants, and or putting a notch in my belt, or so, you know, that theme has played out in my life a couple times.
So when you use it as a power trip somehow.
Mm-hmm. Oh yeah, absolutely.
Okay. And how are you behaving in that realm at this time in your life with your husband? And how is sexuality right now at the present moment for you, positive and negative?
The sexuality is fantastic. There's a great connection. There's good communication. I think that's an area in almost any, we could like insert your topic here. Communication can be improved on, but we have really good communication. He's very patient. He's very kind. Um, it feels amazing. I mean, there's a ton of positive about it.
Any negative?
The negative is I am available. I want it more. And I'm going to say that and then take it back. It isn't that he wants it. He works a job where he's really, really tired physically. And so he may want it, but it's not going to happen. So the thought and the action are not connecting for him. So I definitely feel like I have to chase it. And in that sense, because I don't get it as frequently as I want, I feel rejected. He doesn't make me feel rejected. I put that all on myself, and I'm very aware of that. But I feel like, he doesn't want me as much. Also, I had a hysterectomy 16 years ago, and since that, orgasms have been more difficult. And you and I talked off the air a couple times ago about how that can be hormonal, because I turned 50 this year, and I am taking something for that. I don't have most of the symptoms of having an issue hormonally, and I can track it before the am I before the hysterectomy sex? Am I after the hysterectomy sex? And there was definitely something in that was traumatic for me, physical, mental, emotional, I don't know, all of the above, but it's been more difficult. And as time goes on, it's more difficult. And so that makes me angry.
And when you said there was something traumatic about it, can you share with me what the traumatic concept was?
I lost twins at 19 weeks. So that was the catalyst. It was my 7th pregnancy. I lost twins at 19 weeks, and the doctor wanted to we'll try to save one of them, and I physically was so spent. And this is one of the hardest things for me to admit. I didn't want him to save the twins. I was like white flag tapping out. And I honestly said, do you have to? I mean, well, that's called an abortion, right? And I wasn't thinking about it in those terms, just that I was just so tapped out physically from the infertility and 7 pregnancies and losing twins at 19 weeks that I didn't want the twins to be saved. Now, I went through infertility. I understand the desire to want to have a child and be told you probably won't be able to. And I was blessed that I could. But to go from that to being like, please don't save these twins. And like, how could another woman forgive me feeling that way who wants to have it? You know what I mean? But I miscarried 2 others, and I never felt that way. And I gave birth to 4, and I feel grateful. But the fact that I felt that, and I thought that, and I just wanted it to be over, because physically losing a baby is physically and emotionally hard. Losing twins at 19 weeks on a toilet over several days, I couldn't do it I just didn't want to do it. I didn't want him to save them. I didn't want to go through it. So I ended up, it didn't matter. I did lose them. I couldn't stop it. They kept checking my hormones. I had a D&C. I continued to hemorrhage after the D&C. So I had a vaginal hysterectomy. It went perfectly. They took my cervix and my uterus. One ovary, he said, wasn't functioning. It was dormant. It just wasn't, it's not dead tissue, but it wasn't active. And he said it probably never was. The other one was fine and cystic, which we knew. So he took out my uterus and my cervix. And about 2.5 hours after that surgery, I looked at the nurse and I said, something's not right. And she palpated my abdomen. She touched my abdomen, and I passed out, and I was rushed into surgery. They had to bring a second surgeon in. It took over 2.5 hours. Now, my ex-husband's a doctor, so he's looking at the clock knowing, like, my time is running out. He planned my funeral. I actually was dead on the table. I have no life after death experiences for anyone as far as that goes. But it took them 2.5 hours to stop the bleeding. They used a machine that they ended up cutting me hip to hip, taking out my intestines, suctioning everything out of my abdomen, and they put it through this machine. If anybody knows what that is and what that means and how bad that is, I would love to hear, because I had a doctor once say, they use that machine on you and you're here to talk about it. So I know that that's a big deal, but I don't understand it. So they put your blood through. I had 5 blood transfusions. 3 of them were my own recycled blood. And I was stapled hip to hip, and I came out of that surgery. And I mean, I remember looking at him and going, holy cow, like, what did you do? You're supposed to take stuff out. Like, what did you do to me? And he was just like, he said to me, you were dead on the table. You shouldn't have survived this. And he's like, I don't know how one of your arteries, there's 2 arteries that support the uterus. One of them was sputtering and the other one was like a garden hose. And he's like, you never should have survived this. And we had to take everything out. We opened you up. It saved your life. And you're probably going to have nerve damage and some residual issues with it. So I had those 3. So going from, the twins to being dead on the table and going through that physically. And there's a picture of me. And if I was recovering, and my son, who was a year old, was sitting with me. And when you look at it, people will say, you look like your soul was not there.
Wow.
I was probably pretty checked out. I don't have much memory of that at all. I figured God wasn't ready for me. And so here I am. But there was emotional baggage through that process. And also, I mean, one of the reasons I didn't want to save the twins is because I knew my marriage was really not good, but I didn't know why I felt that way. I felt guilty for feeling that way, and I wouldn't know why for several years later. And so intuitively, I was picking up on a lot that was going on, a lot that was going on in our relationship that I had no idea. And then physically, I mean, it felt like you put me back into a brand new body, a totally different body, and I had to relearn it. So even though the vaginal canal is totally fine, feels amazing, and nobody touched my clitoris, something in the process, although they didn't do anything physically, something in that process interrupted my connection to being able to orgasm. I want sex just as my drive is just as high. After the hysterectomy, he said, you're probably going to get dry and need lubrication. And they said the same thing when I went through menopause. No, I have towels by my bed. Too much information. Like, that's not an issue. So my drive and my desire, my want, and having sex and it feeling good, perfect. My ability to feel like I'm building an orgasm, like I feel like my clitoris is dead. I can't find it, which is interesting because this surgery also, because they took my intestines out, so I lost the urge to go to the bathroom. And I had to learn how my body triggered me, because I don't just go like, oh, I feel like I have to pee like a normal person does. I actually feel pressure and then pain. And I would think, do I have gas cramps? And I would pee and realize that my bladder was so full, it was painful. And it kind of reminded me of gas cramps like before the surgery. So I had to learn new triggers. I have to take fiber to make sure that I have bowel movements regularly, because I have no urge. And I have to just sort of check in with myself and feel pressure and sit down and hang out and just be like, okay, we need to do this. So I really have had to relearn how my body functions in a physical way for 16 years. This wasn't yesterday. So the fact that I have no trigger, no urge to go to the bathroom, it's sort of the same disconnect I have with my clitoris. I've lost the brain to body connection. I can't tap into it. So for me to orgasm, it takes, there's one position in sex I can do it, but I have to use a bullet vibrator 100%. So before sex, I could have sex and have an orgasm during sex. And sometimes it's easier and sometimes it's more difficult, but I had no problem with that connection. Now I can only have sex with a bullet vibrator. If I can make an analogy, I would say like it takes a jackhammer to get, I feel like I have to jackhammer myself I have to almost like force it. That's in my mind what it feels like. And it's almost like 99% of the time, it's after sex is over with fingers and a bullet vibrator. So now maybe there's nothing wrong with using a bullet vibrator every single time. And there's nothing innately wrong with only being able to orgasm in one position sexually. And there's certainly nothing wrong with finishing afterwards with fingers and a vibrator, except it wasn't my normal before. And, you know, like the last time we had sex, I said, man, it takes so much effort for me to have an orgasm. They are so hard when I have them, but I literally have to bitch slap my clitoris into getting on board.
Mm-hmm.
And I know that fingers make it easier because you can touch the G spot more easily than you can during intercourse. My frustration, I think, is that I can't do it like I used to, and I don't know how. But I think the biggest frustration is that I've lost that connection. Like I just, you know, usually you have sex and all of a sudden your clitoris is like, hello, I'm over here. I'm feeling tingly. I have 6 million nerves, way more than a man with a penis. You know, I mean, like.
It's interesting that you explained all of that also about other bodily purging and intestine, and it's your level of acceptance of that in your body language was phenomenal, you know, and then your frustration with this, which you were actually still operating just a little bit harder. You got to put much more work at it, but it's still operating and giving you pleasure. Your frustration is with this. But when you were talking about, you know, removing your intestine and having to really relearn everything about your body, on that one, interestingly, was like, oh, well, it is what it is. And
I think I like the system. It's a different system than it used to be, but it still functions the same way. I can still have a bowel movement. I can still urinate. I don't have any problem with that. I just had to, the triggers were different. I can't figure out how to get the same result for sex in a different way, but the same result. I guess that's my frustration. I can still have an orgasm, but it's not the way I used to. I can have a bowel movement the way I used to. I just have to listen to the cues better. So I feel like there's a disconnect. I'm not getting the cues to learn how to do it like I used to in a different way. I guess using a vibrator is learning how to do it in a different way. I just don't like that way. I feel like I failed.
There's also a difference.
Yeah.
The difference is with the bowel movement or urinating, it is your body and you getting connected with each other and be able to do that. So there's no manipulation that has to happen. It's you got to get inclined with what's going on, and then the allowance to happen.
Right.
Read the cue, create the structure, allowance. This one, it's not, well, the act of sexuality and having an orgasm, it is done with manipulation, and is done with either another person or your own manipulation. So it's not just tuning in and allowing, but it's tuning in and allowing, and maybe other ways of manipulation that has to be a part of that. And it seems like the allowing and the allowing is happening, the tuning is happening. It's just that the form of manipulation has to be different, and it is above and beyond maybe what a partner can do, or that they're not skilled at it in the new form yet, or that it takes a whole different way for them to do it. So then you're taking over with a new style of manipulation to gain what it is. So that's also a difference between these two arenas. They cannot be similar.
And I expected it with my intestines and my bladder. I had a hysterectomy and they opened me hip to hip and took that. I mean, like, I expected to have to relearn how those things work. They were directly impacted. although my uterus was removed and there's a lot of contraction in the uterus during orgasm, so they are connected, he didn't, physically, there was no surgery done on my clitoris. You know, like it was kind of like sitting over here by itself. So I think it was so unexpected, an unexpected side effect that really kind of pissed me off. Like, oh, all this other stuff happened and then this too? Like, seriously? I'm glad to be alive. I'm not minimizing my gratitude, but I should be having, like, I don't have a uterus anymore. I don't have PMS. I don't have periods. I don't have craving. My boobs don't hurt. Menopause has been cool. I did gain weight immediately after the surgery, but like I lost that weight. I felt like a playground. I wasn't stressed about getting pregnant. I hadn't felt that good in some ways physically since I was 15. You know, it removed all of these things that I'm telling you, I was in and out of the doctor's office, hemorrhaging and losing 2 other pregnancies and in infertility surgeries. It was really, really hard, and physically, emotionally it was hard, but physically it was awful and painful, and it was just a terrible situation. And that got all removed. So like I feel better than I have in my life, and now sex is just fun. I'm like a guy now. I'm a playground. Like there's no threat of anything, right? And it's harder than it didn't used to be hard like this. And now I used to be able to have an orgasm with oral sex. I don't even know how long he'd have to work at it for that to happen. And so now
It's a loss that you're not liking at all. All other losses you could find something positive about or accept.
Yes.
This one, it's a loss that, no, I don't want it. I'm not willing to accept it. I want my way as it was before. That's the difference as I hear it.
Yes. And because I am highly sexual, and I want it all the time, then you finally get it. And I feel like you have to, you know, beat my sexuality with a 2x4 to finish the job. And like, I liked oral sex. And now if Dane is so patient and so sweet, but when he tries, I mean, literally, I'm like, look, we've tried this a lot and we haven't been able to figure it out. And I just feel like a failure. I feel guilty. You're trying. So feelings you shouldn't have in this otherwise really healthy, very connected, super great sexual relationship. But it makes me angry because I used to, and I don't like feeling like he's ready to go to bat and, you know, do this great thing for me. And then I feel like a failure. That's a horrible way to feel.
And a burden almost, like.
Oh yeah. Yeah. And I know in our prior sex lives, you know, before we were together and before the hysterectomy, it wasn't like that for either of us.
Sure.
And that sucks.
I know. So in the area of sexuality, what do you assume he thinks about you?
He thinks I'm sexy. He thinks I chase him mercilessly, which I know that he likes. Although the negative side of that is that he feels like he's not giving me enough and he feels guilty for being so tired. And I know that's part of it. And that's a balance with me chasing. There's a part of it that's flirtatious and fun and exciting and sassy, and a part that's like, yeah, now I'm just making him feel bad. So, you know, that part's a balance. I know he really enjoys sex, and we've gone through ups and downs in our relationship, and sexuality aside from this issue is something that has come up. Like, okay, how can we connect better? And we went through a lot of that process. I know that he has had sexual relationships in the past that have been much easier and more fulfilling. So I carry that baggage also. And he doesn't want me to do that. He's not happy. He is the most patient, kind, and he doesn't care that it takes fingers and a vibrator at the end, or that I have to be like, you know, I lost it. Hang on, give me a breath and we'll start over again, which we have to do several times sometimes. You know, he doesn't care that it's taking a little bit longer. He doesn't care that I finish later. It doesn't matter to him. I think the hard part for me is that I want it to matter to him.
Say more about that.
I want him to be on a mission to help us figure it out. And I think he is in a very gentle, kind way. And I want him to be more in a jackhammer way. I mean, I really want him to be like, let's try to figure this out. And he has, but I think it's easy with any partner over time and years to fall into a pattern where you know each other and you just do it this way because this way works, and you're tired, and there's lots of other things in life, and there's stress and stuff. And I really like to keep it spicy and fun. And so I don't want to just do it.
And if he participates in this actively, then the part of you that goes into the thought process and the feeling of being burdened and he's tired and might as well let go, then goes away, because then it becomes it's a play.
Yeah.
Or it's a play that you're both involved in versus
Yes.
He's done with the play, but he's just there being nice to you.
And I think that's a little extreme, because he's more invested than that. But I know the times in our relationship where he's been like more sexually aggressive, it's been easier for me. So I felt I wasn't chasing as much. So that might be a key. When he's more assertive and aggressive and really wants it more, and it's more playful and he's initiating it, it's not like it's tons easier, like, oh, look, now I can have orgasms the old way. But it's definitely takes the pressure off of me, of the baggage that I've packed and have now carried, that I feel guilty and I feel like a failure. And so I know that it's good for him. I know that we got through a lot of the reasons why our sex life and our sexuality wasn't as good for him, and that was several years ago. And I was really grateful that, it's easy to be caught up in why it's hard for me. He's the other half of the equation. Doesn't mean that it's great and easy for him too. So when we made that switch, I was like, oh, good, we're both in the same place. Great. Okay, good. It's not good for you either. Okay, now we can get somewhere. And so the times he's been more assertive in communication and the times he's been more assertive about desire have been easy. I feel a lot less guilt and failure. So I think just in life, we get into patterns, and it's not like it's like that anyway. And it's not like we dread it. It's so good in so many ways. I can tell you what's negative about it, but really it's so little of it. I think the biggest negative thing is that I've attributed all of these situations into feeling like failure, feeling guilt, feeling like I want it more. If you asked him, he'd probably tell you I'm totally full of shit, that's not true. But I still carry the weight of this baggage, and that makes it even more difficult.
So where is this baggage in your body?
Oh, deep in my gut.
And as you go deep in your gut, what is the actual emotion that is being felt right there?
Worthiness or failure. It's just a deep failure.
And when you feel that in your gut, what is it that you're telling yourself? What is the thought or the belief, the negative one that you have about yourself that creates this type of unworthiness and deep failure in your gut?
I tell myself that I'm a failure and I'm disconnected. Like somehow there's a lot of loss. Somehow I've lost something and I don't know how to find it again.
Okay. So close your eyes and connect into your deep gut and really feel the unworthiness, the loss, and allow the sense of loss and unworthiness to really take over your body from 0 to 10. 0, nothing, 10, the highest intensity you experience. What is the scale?
Of loss?
Yes.
At least an 8.
And unworthiness?
It's about the same, 7 probably.
All right. So just really connect with your gut and allow these to just even go all the way to 10. And allow the feeling of loss and unworthiness with the muscles of your gut, with the cells of your body, to take you to the first time or the earliest time that you remember experiencing this type of loss and unworthiness. And that you told yourself that I'm a deep failure.
It's the same memory as last time. It's when my parents divorced and I felt like I lost both of them. And because I felt like it was my fault, I felt unworthy.
And how old were you?
6.
I want you to look at the girl who's 6 and tap into her loss. And tell me, as you're looking at her, and go into who she is in her body, and share with me the sense of loss that you were experiencing as a 6-year-old.
We lost the house, and a lot of my stuff was being sold or given away. And we moved into a really small house. My dad moved to another state. My mom had been working and my dad had been staying at home. I don't have much memory of that, but now we became latchkey kids. My sister and I, basically, I didn't realize my mom was working so much until she was the only one there. So we lost our home, our security, and I lost both my parents because my dad left. And my mom, and she worked and she started dating again, and I felt like we were on the back burner. I felt like I lost almost everything.
So sit with the loss and tell me what other feelings come around it.
I'm super angry.
0 to 10?
Oh, a 10. The anger on that's a 10 for sure.
And where is that in your body?
It's in the same place.
So connect to the anger and allow yourself and allow the anger of the muscles of your gut and cellular memory to take you to the earliest time you ever experienced this kind of anger.
Our cat had kittens. I don't know how old I was. 4, maybe? I honestly don't know. I know my sister was born and I was 3 when she was born. I had to have been 4 or 5. And the cat had kittens, and this kitten got stuck in the bathroom drawer. And I was angry. That's more fear, I think. I was scared and angry, and I didn't want the kitten to die, and he didn't. And right around the exact same time as that, I had glasses when I was 4, and they diagnosed me with a lazy eye, and I had a patch over my glasses. And they wanted to strengthen my eye, and I hated it so much. And I took it off of my glasses and I stomped on it on the bathroom floor. And it happened, this kitten that got stuck and me doing this happened really close and in the same bathroom. And I stomped on it on the floor and I stuck it in a drawer. And I don't remember who found it. I think it was my mom. And she taped it back together, and I didn't get yelled at, but I was so angry. I didn't want to wear it. I hated that patch and I wanted to smash it. That's the first time I ever remember being really angry. And somehow, even though those two incidences aren't connected, they must have happened close enough together that it kind of bleeds over. Like my fear and my anger at my parents for not being sure they could save the cat, and that stupid patch on my glasses. I was so angry.
And as you look at the 4-year-old Jen, who is very, very angry, and you go into her body and share with me what that anger, if there is any other emotions or thought around that anger.
It's much higher in my chest. And I just really wanted to be seen. I felt like my anger was justified, and I just wanted to be seen so I could explain it, because then obviously it would make sense and I wouldn't have to wear this thing anymore. So I didn't feel like I was being seen or understood. I wasn't being understood.
And if you want to be understood and seen, who do you want to be understood and seen by?
For that, my parents, for sure. And yeah, I just thought if they like figured it out and understood me, that they would just tell the doctor he was wrong. You know, in my mind, that's what I thought it would be, that easy.
And then what happened?
My mom taped it back together and I had to wear it. However, within a year, the doctor realized that it wasn't a correct diagnosis and I didn't have to wear it. And I felt like, if you guys had just listened to me before, but I didn't know that I didn't need it. I just knew that I hated it and I was angry. But I just felt understood. So that's what happened. She taped it back together. I had to keep wearing it. And then the diagnosis shifted. And in less than a year, because in kindergarten, I did not have to wear it. So somewhere in the next 6 to 12 months, it was gone.
So as you can, as Jen, who is here today, can check in with the 4-year-old who has had to wear the glasses, what could you tell her? What is she? She needs to be seen. She needs to be understood.
I would tell her that I secretly know that she's right. And if she is patient, that everyone will understand that. That will all happen. You know, the patch will be gone and there's no reason to be angry about it.
And when you say that to her, how does she take it?
Well, she's glad because somebody listens. Like, oh, okay, you get it. And then you have a plan, right? The plan is like, just be patient. They will understand. And even though me reacting in anger didn't result in anything awful, I didn't get punished or screamed at or hit, or like nothing bad happened from my anger. It was unnecessary. And once she feels seen and understood, you don't have to be angry anymore. You have a plan.
Okay.
It is amazing how angry I was about that.
And when you tell her that I'm from the future and I'm coming to you and all will be well.
Relief.
Okay. And
it's like a secret.
So check your anger from 0 to 10 in your chest.
Oh, it's gone. Instead, it's like, and not only is it gone, but like now I have a secret and there's a plan, and that feels awesome.
Great. So I want you to take that 4-year-old integrated within your system, because she doesn't have to be out there alone anymore. Now let's go to the 4-year-old with the kitty cat. And what does she want at that moment?
I wanted my parents to fix it and save this kitten. I didn't want him to die. His name was Oscar. And I was really upset because I was angry because I wanted them to just do it, to just fix it. And actually, because they were patient and took time, they did save it. Initially though, I was scared and I was angry. I wanted them to just make it right.
So as you tell 4-year-old Jen from the future, what is your message to her? You knowing that she's afraid and she really wants somebody to come and fix this because she doesn't want to lose this beautiful kitten.
That they do, like, just hang on because everything's going to be fine.
And 0 to 10, your experience of anger in your gut?
I don't feel angry.
Okay.
I actually feel appreciative. I feel grateful that they were patient and calm and slow and fix the situation.
So ask the 4-year-old in the bathroom with the kitten to also reintegrate with you, knowing that she doesn't need to be out there alone anymore, that you're the future and you're letting them both know all is well. No worries. All turned out well. So now let's go to the 6-year-old. And what are her needs at this time when they've lost the room, they've lost the house, she's lost both her parents?
I would tell her that we got through it. The loss was very real. I mean, I didn't get it back. I didn't get that loss back. But we got through it. And that when I was 9, I would meet someone that I felt so valued and so much worth from, my 3rd grade teacher, that it would bridge this huge gap. So again, I just have to be patient. And there will be someone else. It won't be my parents. But there will be someone else who gives me that sense of worthiness, of being worthwhile. I'll be worth it to her, and that will go a long way in healing me.
And as you're looking at her and saying this to her, how does she receive this?
I think it still feels overwhelming because 6 to 9 is 3 years, and that's a really long time. And to know that, to believe that even though you've lost something and you don't get it back, it can be, you can feel just as fulfilled in a different way. That's really hard. And it seems like a long time and a lot of, and you still lose everything. So I think that there's relief in it, but there's also knowing that you have to process that loss.
Is it okay to grieve?
Yeah.
Okay.
And then in the end, with my father, it will be a relief that I lost him, but that's really hard too. Like, losing him was the best thing that could have happened because he became so violent. So that even though it's really hard at the time, Um, that's far better than the alternative. And that's just really hard. And yes, it's okay to grieve that.
So as you connect to the 6-year-old, if you check with her to see in yourself, in your body, in your deep gut, unworthiness 0 to 8.
Oh, she ends up knowing she's worthy. So there isn't unworthiness anymore.
And loss 0 to 8.
Loss is still there. It's probably a 4. It can be really hard to lose something, even if you know it was the better option. It was definitely the better option with him. Hands down. So I think I've come to terms with the fact that you have to, and he's died. So, and it was a relief. You have to come to terms with feeling okay that you're going to grieve and that that's just the way it's going to be and you're not ever going to get that back. So although there's still grief there, I feel comfortable. It's okay. My mom's harder. My mom was really good in a lot of ways and really not in a lot of ways. And the grief was, for me, at that age and learning as I got older, that grief of losing her, that she could have been so much more, but she chose not to be. So that grief of loss, I think, has never left me the same way as I've come to terms with it with my dad. Losing the house and losing the stuff, that comes and goes. That ended up not being a big deal. Even though at the time it was really hard. I remember other little girls coming over and looking at my stuff and buying it. It was hard. I didn't understand. But that part was fine. That was okay. But knowing that it could have been different with my mom and it wasn't because of her choice, the grief at 6 that was starting became much worse over time. And that's been really difficult. So although I may understand as an adult, I can be empathetic and realize that she was trying to raise 2 little girls basically by herself while still living her own story. Kids don't realize parents are living their own story, you know? So there can be a lot of forgiveness in that, but there's still loss. And I don't know how to make that better for the 6-year-old or today. I mean, I still carry that grief of loss about my mom.
And it's okay. It's okay to grieve, and it's okay to accept that the loss is there. And if you, as you go to the 6-year-old from her future, what do you tell her about her future?
It's gonna mold her into a very strong person, and she will try 150% to give her best to her kids and to everything. And that some days that will look like 150%, and some days it will look like a fraction, but that's not because the effort wasn't there. It taught me a lot about what I didn't want and how I wanted to be different, and that I'll make a slew of different mistakes, and that's okay. You know, I don't blame my mom made her own mistakes, and I may not have made the same ones she made, but I made other ones. So it's like a check and balance thing. So I won't be as hard on her about it later. Because I'll understand it from a different perspective. And it definitely molded me in. And I learned that I can be worthy to other people. And more so, I learned my own personal worthiness. And that was probably worth the struggle.
Yeah. So going back to your deep gut and checking loss 0 to 4, where is it now?
It's still probably a 2. I think I'm always going to feel just like that grief. I lost something that could have been so much better. I don't know that will ever be, I don't know how that will be, but I think it's gotten better over time. And even just today with you. But there are things in life that I've lost. I've lost other people to death. And like that loss is, I don't know that I even want it to be a lot less than 2, because some of it is just missing someone you loved. So it's probably about a 2 on that loss. Yeah, with my mom. And that's a comfortable, dull number. I can live with that more than 8 or 9.
Good. All right. Now I want you to come back with your relationship with your body.
Okay.
And as you connect with your body and the loss of some functions, tell me what shows up for you.
I'm just really sad. And I know it's, I mean, death aside, it could have been so much worse. But I'm really sad and I feel guilty. Like somehow I could have, or I still could do something where I don't feel that as much. It's that same little girl feeling. I lost the twins and I wanted to, so there's a lot of guilt in the loss, you know, and a lot of fear that I won't get things back the way they used to be. Or that I just can't make this physical, emotional, brain-body connection and find myself again. And I'm pissed and sad that I lost what I did, because it was fun and great and a huge part of who I am. And now I feel like I'm still that, but I can't execute it. And I feel bad about it.
And what do you think that your responsibility is in that moment? You feel so guilty about?
Because I was relieved to lose the twins, and that, not that I could have controlled any of it, or that thinking that made it happen. I mean, I know where I was at physically at that point. I know where I was at mentally at that point. But it feels almost like a punishment. So, and because I didn't want them and I had to have those 3 surgeries, well, I got what I wanted, didn't I? So how can I complain about where I'm at when that, you know, that was a price I paid for not wanting to save these twins? And there's no way. I mean, when he said it to me, I remember thinking, like, is that possible? Like, how is it possible when you're hemorrhaging this much and I'm in the hospital? Like, how is that even physically possible to do?
So I do understand. I want to take you to the Jen who was at that time.
Okay.
Now I want you to look at reality, not what you made up for yourself. I really want you to, for a minute, look at reality. That although there was a question that came in front of you, and that you appeared to have some answer, in reality, at that moment, did you have any other choice than what happened?
No.
Thank you.
No, I absolutely had no choice. And the fact that I felt the way I did was a side effect of just the whole situation.
Thank you.
Any woman who has delivered twins at 19 weeks on a toilet, alone, hemorrhaging, would understand how you have no control, and that there's a moment where you're just like, I just wanted to be there for the kids that I had. It wasn't even as much as not wanting them. It was more like, I don't know if I can make it through this. I need to save myself over them.
Yes. Yes. And you did the right thing. Yes.
I couldn't control it anyway, but
you could not control it anyway. It was not up to you.
And I still feel like somehow I'm being punished for something. And that doesn't even, logically, that doesn't make sense, but emotionally, that's how I feel. They don't play well in the sandbox together, logic and emotion. Like it was like.
And what is the punishment?
That I am totally disconnected with my clitoris and the ability to be able to normally, or like I used to, or like I want to, or more easily have an orgasm. Like, okay, you lived and you didn't get the twins and you got what you wanted, but.
Well, the option was given to you to have a life or an orgasm. I guess you got life.
I know. What a shit for complaining.
Yeah. You were dead.
Yeah, I was told that. So.
You were dead. And then there was an option. You can come back and alive.
Yep.
And the one thing you might lose is to have fast orgasm. You still haven't lost a little bit of an orgasm with patience. The only thing you lost was a fast orgasm, but you got your life back.
That's true. And so then that's part of the guilt. Like, really, what do I have to complain about? There are lots of women out there who have a much more difficult time than I do now.
You can still be pissy about it. That's okay. But I think that to come to some sense of reality that, one, you didn't have anything to do with it. So what are you holding the guilt for?
Right. It's not serving me.
Well, that's just a delusional concept, right? Because you really had no option of making choices at that moment, although it appeared that somebody came and asked you, like, would you? And then you came up with an answer, but realistically, you really...
Yeah, I don't remember having any angels visit me or seeing the light or being like, okay, so here's the deal.
Yeah.
Plan A is you can hang out with us.
Yeah.
Plan B is you go back.
Right.
But, and of course I would have said in a heartbeat, if I had that, if that actually happened, or I remember having that happen, I wouldn't have even hesitated. What a great thing.
Right. So again, I'm going to go back to your body and check guilt. 0 to 10.
It's pretty much not there.
Good. Wonderful. So now let's go back to loss.
Yeah.
0 to 10.
I still feel loss.
Of course. 0 to 10.
Probably a 3.
All right. And it's okay. It's okay, because I think that one of the things that happens is that as long as you're not accepting the reality of what has transpired, that whenever there's a trigger that reminds you of that, you also go into a loss. Oh,
that's interesting. Okay.
Because when you were talking about bowel movement, there was no loss, because that is a huge loss, but you did not even register it as a loss. So right now it's like, all right, I just have to be patient, which you kept saying to your 4-year-old, 6-year-old. You kept telling them, guess what? If you're patient, life changes. If you're patient, the future will bring something else. Don't worry about it. If you're patient, it all will be well. And you also doing exactly the same thing with the urinary tract and the bowel movement.
Yeah.
You're being patient with yourself. You've learned how to listen to the triggers and go in the bathroom, sit patiently, connect, and allow the release to happen with no guilt and no loss. On this one, you're holding another belief around it.
Yeah.
And every time that that becomes relevant, that I have to have patience, I just need to connect with my body, and I need to stimulate it in another way, then you go into the rage, the loss. It all shows up how different this is.
Right.
Although other stuff are different, but it's okay.
I hate that I never put it together. Like some things were no big deal and other things I'm pissed and feel loss from the exact same moment, from the same situation. Yeah.
And I get it, that the significance of the
Yeah.
orgasm and the pleasure that you gain out of that. It was almost like having orgasm for you was a prize. It was an achievement. It was something that you got that was yours. And therefore taking that away appears to be a punishment to you.
Yeah.
I guess that's how you interpret it. And then from there on, every time it happens is as if it's a punishment and you're being punished, and you get angry at it and you sense the loss. And that's the significance you put on that type of a body function versus the other type of body functions. You put
Which
that.
seems so silly, right?
Yeah, I mean, I totally understand why that is way more significant, because there's so much more pleasure in intensified pleasure. The other ones is just like relief. This one is an intensified pleasure, and it's a reward. Like, shit, this is a reward, and somebody, damn it, took the reward from me.
Yeah, it's a Pavlov's dogs thing for me. Like if you hit the button, you get the cheese,
Yes.
And I figured out ways. I mean, it wasn't that it wasn't frustrating for me in the beginning with everything. I mean, literally in that several month healing process, I had to figure out everything. But I realized, okay, if I take fiber, I poop. I can't just, if I notice that there's pressure, I have to pee. I haven't figured that same thing out.
Of course you have. You told me.
Okay, I use a vibrator and fingers.
Thank you.
Fiber was better than fingers, I guess, So.
Sure about that.
I mean.
A bullet in the finger in orgasm always is better than a fiber and pooping.
Okay, I'll totally give you that one. I will totally give you that one. It's just not the same. Yeah, it is like a reward. It is. And I think a lot of my sexuality and confidence and feeling, and again, control is not the right word, but that ownership of my sexuality, a lot of it was in my ability to be able to reach that orgasm and do it during sex. And it was that whole connectivity part. For me, I feel like waiting till after finishing that way, although it feels good, like I've lost some of that connection to my partner and some of my control and my confidence in it too.
How old are you?
I turned 50 this year in December of 2020.
So if we come up with an amazing sexual reward that is for a 50-year-old female, and we can design that reward, because the first reward was kind of like given to you by nature.
Right. Yeah.
Now let's design one that you can call reward, and that you can either claim as is right now or created in the area of sexuality.
Okay.
what would that be? What would you consider a reward beside the orgasm?
Oh, more frequency
Okay.
would be great. Exploring other alternatives.
Mhm.
So I can use the bullet on myself with no fingers and have an orgasm. But what if there are other options that I don't even know that are out there? Like, I know they have lubricants that are stimulating. I don't know, like that. I know there's that one, but like, how many other things are there out there that I don't even know about that I could try? So the reward wouldn't be the orgasm. It would actually be having the patience to try other options. Yeah, I just love it when I talk to you and I know my words just came right back at me from my 4-year-old self. That would be, you know what else would be a huge reward is to try some things outside of sex, like with Dane. So, hey, I got this, or I want to get this, or we got this, or whatever, because he can be part of the whole process. That would be fine. But I got this stimulating cream and I want to try it just with you without. I did try one thing once. It was a like a KY type stimulating thing, and it burned him. And so I think I'm a little like, let's try things first and see if they work with me, and then add you to the mix just in case.
How about the curiosity and play?
Okay.
How about play?
Okay.
And play then can be anything, right? Like it'll be new play. You will find, it'll be products you will find. It'll be, wasn't that book? There was a book about 100 ways of having sex. What was it? The Indian one? I'll find out for you.
Okay. Okay. I'll put it in the show notes.
Yes, like different ways of having sex, sexual positions.
Right.
Um,
Breathing comes to mind.
Breathe. Oh, tantric sex.
Okay.
Tantric sex. You know what? They have orgasm without orgasm.
I know. I don't understand.
There you go. There's one thing to go and find out how.
Right. Those
right?
would definitely be rewards instead of sticking to what the one thing. Yeah.
All right. So play.
Yep. I like the word play.
All right. So as you envision yourself in the area of sexuality, who do you intend to be?
A goddess.
What kind of thoughts you want to have? What kind of emotions? What kind of behaviors? What kind of values?
I want it to be fun. And I think you've just pointed out by using the word play that I put so much pressure on myself that it's not as much fun, which could be an enormous part of the problem in and of itself. If
and
I
remember,
yeah,
the whole focus, the whole intention, biological intentionality of even putting an orgasm for you as a female was to have fun.
yeah, it should
Thank
be.
you.
I mean, I've loved it since I was 17. So,
but do you get that was part of the design? Like the design for a male to have orgasm was to procreate. The design for the female to have orgasm was
just fun. Just fun.
So remember, you cannot take away the actual purpose of it.
Right.
So
yeah,
it has to be
I have.
Okay.
I've totally robbed myself of the play. So yes, the play is, so I've always been really confident and self-assured and very sexual and sure of my sexuality. And I think I want that part of me back. And that doesn't have to do with the orgasm either.
So I'm sexy, playful goddess?
Yeah. It's very empowering and fulfilling. And that's the goddess part. I loved it. And I just forgot
Right. As an intentionality of the sexy, playful goddess, what kind of a thought process would you like to have in this area of life? Beliefs.
Oh, I think I need to be less hung up on the orgasm and more about the play and about my body. As far as beliefs, that it's not
Putting significance in all of the journey, in all of the areas of sexuality, and not just get limited to put significance only in one area.
I think the whole thing should just be fun.
Thank you. Okay. And intentionality of emotions that you would intend to feel.
Oh, happy, playful, connected in a different way. Closeness. Yeah. I'm so sarcastic and playful in my life in general, and I used to be in this area that I think it's just a reclaiming, actually.
Beautiful. Behaviors that you intend and committed to create and to have.
I want to look into things more. I think learning about other options, first of all, that's fun, but trying them and without the intent of orgasm means that it is just fun. Like, it doesn't matter if it just totally flops. That's fine. That's no big deal. Like, the whole thing, I breathe and pass out, or I fall asleep, or, it just doesn't matter. That I need to be detach myself from the result and just be more part of the process and the journey. So I think my intent is just to study and learn and try things.
And if you were going to put that in an action form, how would you kind of like commit yourself in your calendar to put what you just said in an action form?
I love mornings, and I already have time. It says time for Jen on my calendar. Mm-hmm. And so that is the time where if I'm going to masturbate, that's already when I do it. So I have the time. It's set aside. I like doing it. There's no issue with that. It's just I can also do some research in that time frame and try different things. And to remind myself, even if I have to put it in notes on my calendar, to be patient with it.
That's your word.
I know. I just hate that you threw it right back at me.
It was a good one to come back at you with.
Damn you, Dr. Foojan.
It was Kama Sutra.
Yeah. Oh, yeah. Okay.
Kama Sutra, 100 ways of having different types of sexuality. And I remember even having the book with all of it. Some of it you look like, really?
Yeah.
I can do that?
No.
Without breaking my neck, I can do that.
Yeah, I think definitely. And one of the things that I have to do with intention is being open in my communication, because I don't think I'm going to have resistance, but the process may not be as fast. I'll be like, we're going to try a new thing every day. And Dane's like falling asleep on himself, like literally trying to stay awake and listen, because he's very on board, but I need to be patient with that too.
Right. I did share, I did go, just for sharing with you, I did go to experience individually, and I know they have couples, and I've heard that they have amazing couples retreats and classes for tantric. I went to one which was individual, and it was amazing. It was women sitting in a circle, men sitting in front of them, and then, we switched. And it was more like, when you talk about patience and playfulness and connection, like holding a hand and really massaging a hand while you're looking at each other's eyes, and the sensuality of that. Right. And then another one, and then your feet, and then feeding you. And this was just like everybody was there with their clothes on, and this was all like 2 hands, 2 feet, and strawberry in the mouth. Right. But the amount of the energy and the playfulness and the connection and the buzz was so out of this world. And then I've also heard from the couples retreats that when you talk about how to connect to your body in a whole different way and really feel the feel without and it's lengthy, and there is no pressure of let's do it now and let's get to this, because it's a whole different way of being with your body, versus thinking it's going to be this way and up an orgasm. It's re-relating to sexuality in a whole different way, where orgasm only becomes one part of the pleasure while everything else out of it is also a reward. So I really suggest just check into all of these different playful ways of knowing what works for you and your body in this new way of being, where you need to connect to your body in the sexual realm from a different place.
Right. Yeah, I'm excited about it. Makes it exciting again.
Good. Can you close your eyes for a minute and scan from the top of your head all the way to your toes? And tell me if there's anything going on or tension, anything that we need to release.
No, my gut feels super relaxed.
Wonderful. So just, imagine a white light or any color light that you just, for you, it means peace and love and grandness and beauty, and just allow that to be experienced all over your body. And you can open your eyes whenever you're ready.
Thank you so much. Thank you. I appreciate it so much.